If you're a little self-conscious about the size of your forehead but don't think bangs like this are a good choice for you, did you know you can permanently lower your hairline? Dr. Thompson is back on the show from Utah Facial Plastics. You and I have talked about a lot of different procedures, but Dr. Thompson, I didn't know you did this one.
Yeah, this one is not so well known or so common, but surprisingly I have a lot of women mainly come into my office and complain that their forehead seems to be out of proportion with the rest of their face.
Okay, so let's talk about that. What do you mean by proportion? What would be a hairline that is just about average?
In plastic surgery, we talk about the rule of thirds, meaning the forehead from the eyes to the bottom of the nose and from the bottom of the nose to the chin should all be about equal thirds. And when that's not the case, sometimes things look just slightly out of balance.
Okay, so my hairline would be if I move these bangs to the side?
Yes, and you wear bangs, you could go either way. You could pull your hair back. It really is a pretty equal third, those three segments.
Is it because of thinning hair on the hairline? Is that what we're talking about?
It's not usually thinning hair. Most people have had this their whole life. It's something that they may be self-conscious about. Sometimes they don't want to pull their hair back because they feel like they have too much forehead showing.
So what is the procedure that you do to correct that?
There are two different ways to manage this. One is to literally remove a strip of forehead skin and pull the scalp down to make the forehead lower, the hairline lower. That of course leaves a scar. We can usually hide it pretty well, but it does leave a scar, and I think we have a couple of pictures of that to show.
And that's the procedure this woman had done?
Yes.
Okay.
And there's a little bit of almost like a zigzag scar that you can see there, but you can see the size of her forehead is significantly smaller now. And it looks better. It looks like it's in better balance. Yes, it looks much more natural.
And what's the other way to go about this?
The other way to do this, and it's shown in this picture here, is you can actually transplant hair into that area if you don't want to have a scar. The downside of that is it usually takes a long time for that to fill in and requires some degree of patience.
Where do you choose the hair to transplant?
Usually we take it from the back here where we can hide where it's been removed and then move it to the front.
Which one do you like better?
You know, I prefer, obviously it's an individual situation, but in general, I feel like the surgical lowering of the hairline is a way to get an immediate result. Yes, you have a scar to deal with, but that fades quickly and then you're there, whereas the hair transplant may require a couple of different sessions.
I love, Dr. Thompson, that we're talking to women out there, because I think so often when we do talk about hair loss, it's men that we're discussing, but women deal with this too.
Yeah, I mean, I have a lot of women come into my office. Sometimes they have an irregular hairline. They might have a widow's peak that they don't like, and there are a lot of things that we can do with hair transplant to make that. Or some women even have temporal recession, meaning, you know, they have more of like a male pattern recession of their hairline, and that's something we can work with.
Talked about this on the show before, but my husband Scott had the hair transplant, and he had it done just been about a year and a half ago, and he was the talk of the most recent Cinco de Mayo party. It looks so natural that all the guys were coming up trying to see where you had it transplanted, where you had it done. He's so happy with it.
Yeah, and you know, the technology has really advanced to the point where you can really do a hair transplant and make it so that somebody really can't tell that anything was done, and you look at before and afters and you're like, wow, this looks so much better than it did before.
And you're right, the results weren't immediate, but I actually like that, because it was this gradual change that nobody really noticed until he had the fullness back in his hair that he was looking for.
Yeah, it's one of those things. It actually takes a year for the hair to kind of fill in, but sometimes that's a good thing, because most men are not so excited about everybody knowing that they had a hair transplant.
So if this is something that you're thinking about, everybody, Utah Facial Plastics is the place to go. That is their website, utahfacialplastics.com, and the phone number. I have to say congratulations to everybody there too. They just won 2019's Best of SLC for plastic surgery. So I think they're amazing, but so do a lot of other people that hopped on there and voted, so congrats to you.
Thank you very much.
You guys always do such a great job.
Appreciate it. Thanks.
Good to see you. Up next, everybody.